The word apnea means cessation of breath. If you have sleep apnea, your breath can become very shallow, or you may even stop breathing while you are asleep. Obstructive sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts during sleep. The picture on the right depicts the anatomy of sleep apnea. Several types of sleep apnea exist, but the most common type is obstructive sleep apnea, which occurs when your throat muscles intermittently relax and block your upper airway during sleep. The most notable sign of obstructive sleep apnea is snoring. Anyone can develop obstructive sleep apnea, although it mostly affects middle-aged and older adults and people who are overweight. Obstructive sleep apnea treatment may involve using a device to keep your airway open or using a mouthpiece to thrust your jaw forward during sleep. Some people undergo a procedure to change the structure of their nose, mouth, or throat in severe cases. In adults, the most common cause of obstructive sleep apnea is excess weight and obesity, which is associated with soft tissue of the mouth and throat. In children, causes of obstructive sleep apnea often include enlarged tonsils or adenoids and dental conditions such as large overbite. Signs and symptoms of obstructive sleep apnea include excessive daytime sleepiness, loud snoring, observed episodes of breathing cessation during sleep, abrupt awakenings accompanied by shortness of breath, awakening with a dry mouth, sore throat, or with chest pain, morning headaches, difficulty concentrating throughout the day, experiencing mood changes such as depression or irritability, difficulty staying asleep or insomnia, or having high blood pressure. Regardless of age, obstructive sleep apnea can lead to serious complications, including cardiovascular disease, accidents, and premature death. It is important that anyone with signs and symptoms of obstructive sleep apnea, especially loud snoring and repeated nighttime awakenings, receive appropriate medical evaluation. I will allow Brittany to tell you a little bit more about complications and risk factors for obstructive sleep apnea.